Patients have a lot of questions about hyperbaric oxygen therapy. I'm sure you do too. We understand many people don't know about the healing benefits of hyperbaric medicine, much less understand how it works, until they need it. We're trying to change that paradigm with this channel as a tool for education and engagement. So thank you for subscribing, liking, and watching. Many patients are referred for hyperbaric medicine by their primary care provider or a specialist for complications from cancer, infection, trauma, and wounds. They don't have a clear understanding why, other than it's needed for healing, and that's reason enough. During the initial consultation, we welcome all the questions and relish the opportunity to listen. It's how our clinical team builds rapport and trust. Our team is highly focused on a positive patient experience. Making evidence-based hyperbaric oxygen therapy a difference maker in their well-being and quality of life is our goal. So let's tackle the top questions our patients ask prior to their first hyperbaric oxygen treatment. A thank you to our patient advocacy team for sharing the top things patients want to know. Charity, start us off with number 1.
How many hyperbaric oxygen treatments do I need?
For most patients, the average number of hyperbaric oxygen treatments is between 30 and 60, as set by evidence-based clinical studies and protocols. Of course, this number varies according to a patient's response to hyperbaric oxygen therapy, overall health status, and commitment to consistent treatment sessions.
How often do I come for treatment?
We're here for you to receive hyperbaric oxygen therapy on consecutive days, Monday through Friday. You're assigned a designated treatment time until you are discharged, but there is some flexibility to accommodate physician visits. Showing up every day is vital to outcomes, so we ask you to make the business of getting well a priority in your life.
Nothing's more natural than oxygen, but the fact that it required 60 treatments is a huge commitment. I live 20 some odd miles away. And I was fortunate enough to be able to take advantage of that, and I made every session, and I actually got to the point where I looked forward to coming here, just as you saw when I got here. It's like coming back to old home week and being around people that you love and care about a lot. So yeah, that's a huge factor, is staying the course, and I knew that if I gave it a chance, some people expect immediate results. And one of the things that I learned about HYOX is your body adapts over time. You've got to give it a chance to heal.
Ultimately, each patient needs to ask, what do I want? Is it to heal? Salvage a leg? Resolve this progressing infection? Reverse the radiation damage causing so much pain? Prepare my soft tissues for a successful surgery? Do I really want to get well? If yes, the question behind the question is, what do I need to do to get what I want? The benefits of hyperbaric oxygen therapy take time to achieve, but it's nothing like the time and resources you spend living chronically sick, at risk and in danger of more complications and hospitalizations.
Where do I breathe the oxygen under pressure?
In Georgia's largest hyperbaric chamber, measuring 31 feet by 9 feet, or at least that's the case at HYOX here in Atlanta. The multi-patient chamber can treat up to 12 people at a time, providing more safety, space, and comfort than other monoplace or one-person chambers. The non-claustrophobic treatment environment has more space for you to move, sit up, read, work, or watch a movie. You can recline or remain in a hospital bed if needed. We even have a bathroom inside. Another added value is a physician, nurse, or technician is always inside the chamber to attend to your needs. It's a benefit of HYOX's multi-patient chamber that gives patients peace of mind.
How do I breathe 100% oxygen?
100% oxygen is delivered through your clear hood, making it easy to communicate, read, and see during treatment. The chamber is filled only with compressed air for safety.
What do I wear in the hyperbaric chamber?
Show up for treatment like you're coming for a spa treatment. We have dressing rooms to change into cotton scrubs and lockers to keep your street clothes. Like a spa, we have clean scrubs waiting for you each day. Makeup, hairspray, wigs, perfume, skin lotions and shaving lotion containing a petroleum like Vaseline or an alcohol base are prohibited inside the hyperbaric chamber. If you wear contacts, please wear eyeglasses into the chamber. No articles like watches, jewelry, hearing aids, and prosthetic devices are allowed. If you are receiving wound care in tandem with hyperbaric oxygen therapy, your wound dressing may be left on during treatment. Rest assured, a complete list of prohibited materials is reviewed prior to your treatment for your safety. And our clinical team always checks each patient prior to going in the chamber.
Is hyperbaric oxygen therapy covered by my insurance?
In most cases, for hyperbaric oxygen therapy's approved conditions, yes, it's covered. Medicare, workers' comp, and other third-party payers cover what we treat. As with all claims, copays and deductibles, coverage varies depending on your insurance. We have a team at your service for pre-treatment authorization, financial counseling, and billing claim assistance.
Are there any side effects? In other words, they're asking if hyperbaric oxygen therapy is safe.
Most people report mild or no side effects to our safe, natural, and non-invasive treatment. If lightheadedness is reported, it usually subsides soon after treatment. The most reported side effect is the treatment's risk for barotrauma in patients who can't clear their ears during the pressure change. In rare cases, vision changes can occur due to the pressure changes in the delicate tissue of the eye. Side effects reportedly subside within 6 to 8 weeks after treatment. Since HYOX features a multi-patient hyperbaric chamber, not a small one-person chamber where you recline, reports of claustrophobia are few.
What does treatment in the chamber feel like?
Although hyperbaric oxygen therapy is painless, you may have a sensation of fullness or popping in your ears as eardrums respond to changes in atmospheric pressure during the compression or descent phase in the hyperbaric chamber. As we go to a virtual descent of 45 feet below sea level, the chamber itself doesn't move, but the pressure inside changes, reaching the equivalent of 2 to 3 times the pressure of air at sea level. The feeling is like traveling up a mountain, changing altitudes in an airplane, or changing depths while scuba diving. You'll learn techniques for clearing your ears to adjust to the change in air pressure, and we'll check your ears before every treatment. Dr. King and Dr. Chirila refer patients who continually struggle to clear their ears to an ear, nose, and throat specialist for pressure equalizing tubes. You'll also feel a slight hot-cold temperature fluctuation inside the chamber during this compression time and when you ascend back to normal pressure called decompression. Our hyperbaric chamber is temperature regulated, so it's comfortable when you reach the prescribed depth.
What is happening to my body during treatment?
It's healing on a deep cellular level. As you breathe in 100% oxygen at pressure, you're giving your body the most natural and essential nutrient for good health in life. Based on the laws of physics, Boyle's law, Henry's law, and Dalton's law, breathing oxygen under pressure in a hyperbaric chamber allows oxygen to be dissolved in the plasma portion of the blood. Oxygen supersaturates the body's plasma to feed starving tissues and cells, advance the healing process by creating new blood vessels, and ultimately improve your health and quality of life. For more information, watch our top 5 health benefits video linked in our show notes. The biggest question some people ponder in life is, would blank have made a difference in my life? In this case, we challenge our patients not to ever ask if hyperbaric oxygen therapy would have made a difference. Why? Because it's a question people always ask after they have given up. So don't give up. We're here for you.